Thanks for staying with us right here on Sunrise as we continue this morning. Well, it is that time of the year where everybody gets celebrated. And in our health slot, we're doing exactly that today under the theme Beyond an Extra Mile in Saving Lives. The Mpumalanga Healthcare Professionals Awards will be recognizing healthcare workers and rewarding them for the good work they provide to patients as well as communities. This event will be held on the 8th of December at Emnotweni Arena in Mpumalanga in a sport. Now, these awards will start in Mpumalanga and to be extended to all other provinces, and winners will compete nationally in December of 2018. To talk more on these, we're joined by the event organizers, dietitian Sylvia Masango and Dr. Prudence Buthelezi. You at home can be part of our conversation if you'd like by giving us a call on 011-447-1742 or 1620. Now, good morning to you guys and thanks for joining us.
Thank you.
Okay, so firstly, let's just talk about the conditions that you have to work under. When we think of the the health sector, there's a lot of things that are going on even in current times. As a doctor yourself, what are some of the challenges that doctors are facing, especially in public hospitals?
Yes, what is so good is that I'm also a sessional doctor in the public sector. So the main conditions that we face is the shortage of staff. You find that there's a shortage of healthcare practitioners. The physiotherapist is only one in the public sector, and in the ward there are 20 patients with CVA or with TB or pneumonia that the physiotherapist must see, and she's the only one. And also, like the preterm babies, you only find that the dietitian is only one in the public sector. Then the shortage of staff it's the big challenge. That's why you also find the long queues in the public sector because of the shortage of staff and also of the nurses, you know. And then another shortage of things is the shortage of resources. There's a lot of resources that are short in the public sector. For an example, if I can give, you are sebenza good ama-trips. Sometimes good izinto fanele usebenze ngazo, and then ufanele uthathe lapha nalapha yana uhlanganise to save to go an extra mile to save the life of the patient. And another condition that we look at is the hours, especially when it comes to the doctors, the abnormal hours, because we told you on call, we work 24 hours. The following day, you must give a report to those who are coming in the morning, what we call the ward rounds. Then you told you chaisangabo one. So these abnormal hours, then they lead to most of the healthcare practitioners who told you bahamba by a driver as a pet of tongue, and then they involved in the accident.
Or so they're just irritable in the ward.
Yes.
So when you are organizing these awards, did you take all of those factors into consideration, Sylvia, when you saying we're going to honor some of the professionals?
Yes, we did take these conditions into consideration, because we wonder if a person asebenda those long hours, it's really going an extra mile. Because if maybe you were not called for guba ngdogotela, sometimes you might say, no, Kale Babata must only work 8 hours, but you cannot do that as a health professional. You say, you know what, I took an oath, I want to save people's lives, so I'm going to continue so that at least in save my lives of these patients, because these patients depend on me. So that is why we're going to look at that as well. And that is why Lana, the community or the patients are the ones who nominated these healthcare professionals, because this doctor was here even yesterday, even at night I was seen by this doctor, even this morning still in this doctor. So why this doctor is really doing good, let me nominate this person.
So obviously, in terms of like when you organize these awards, what sort of message do you want to put out to the professionals within the healthcare?
As much as we work in the conditions, even in private, that we are facing so much problems when it regards to medical aid, is that it never give up. This is a calling. Let's save our community with love and care. To put that thing in our heart that we are here to save the life of the community. Let's be there for the community. Let's save them.
What sort of process did you use to nominate? You said the community is involved. Did they the ones who nominate and they decide on the finalists? Just take us through the procedure of how people qualified.
Okay, we send an advert via radio stations and social media, a call out to the community to nominate their best healthcare professionals. So they did that. There was a link, and even on WhatsApp and social media. So they sent through the names of the healthcare professionals whom they thought they deserve to win, and they are going an extra mile. So we contacted those healthcare professionals who were nominated, and we gave them forms to fill in, and we asked them to submit their qualifications and relevant documents, because we don't want a situation
where you have a bogus doctor.
Yeah, you know.
Yes.
Yeah, so we didn't want that situation, because I need patients will think this doctor very qualified, only to find they are not, and we are honoring them just because they were nominated. So that is why after they were nominated, we sent them the relevant documents to complete and submit. Then from there, all those professionals who responded to that call of nominations were voted for, because we wanted to still motivate the community. It's okay, now that you've nominated them, vote for them, so that it's you want to appreciate these healthcare professionals. So they voted for their best healthcare professionals. So now the judges will sit and look at the vote, and also look at the documents that they submitted, because there are those who are doing community work out there. So that also counts a lot, because you find as a healthcare professionals, I'm not only focused on what I'm here to do, but I also want to impact lives out there. So I get involved in the community, so that also counts a lot.
So you work in a rural setting. You're telling me you work at Mpumalanga Hospital,
yes,
where I was born, so I got very excited. Okay, so it's a rural setting, and then the challenges in rural area is like there's just a high number of diseases that you're dealing with, and you spoke about the pressure that the professionals have to work under. This initiative, how do you think it's going to uplift those professionals who work in such spaces?
What I can say is that when we are working in the rural area, even if there's that shortage of resources, it do an extra mile to save the life of the patient in such an extent I'm a patient very bad. What we want more ama healthcare practitioners, let them be united and work together, for the sake of the patient, show burn out, because most of the time as healthcare practitioners we suffer from burn out. But the following day I must be at work. Then the patient, they expect me to smile and to work. What we want to alarm the community, not we are human. We go upon a bus, not we are human. We also undergo depression. We go through the financial problems. We also face financial problems, but people, they don't think that we have problems like any other people. So we want to highlight the community that we are also human. Don't expect me to always be lovey-dovey and everything. So
imagine. Okay, we hear that. Okay, so the dream is to have these awards going to different provinces. Just tell us a little bit about that.
Okay, so this is the first one in Mpumalanga. So the people that are gonna win in Mpumalanga will compete nationally, because we still want to take it to other provinces, Limpopo, Eastern Cape. So after we've gone to all the provinces, then the winners of all the provinces will compete nationally. Because this is the first initiative of its kind, and already we are getting calls from other provinces to say, when are you coming to our provinces? Because we are so used to the music awards and all that, but we are not used to celebrating healthcare professionals, whereas they really do a good job in saving lives. Because but everyone, if we are whether you're an engineer or you are whatever, you will go to a healthcare professional. So that is why we believe they need to be honored, because they are doing a great job out there, and to also motivate, because those who are demoralized and demotivated, patients with the bad attitude, but we want to motivate them, because now you are imagine a penny, if every day the kids are complaining, the husband is complaining, they are blaming you, hey, you didn't do this, you didn't do. But if that one person who will say, wow,
you've done a great job. Everybody wants to be encouraged and motivated.